Laboratory Decision Systems, or LDS, is a test ordering and utilization management software that allows healthcare providers to select and order the most appropriate laboratory tests using evidence and knowledge-based guidelines and industry best practices. This is a proprietary compilation of databases and scoring algorithms to make lab ordering simple, accurate, and matched to medical necessity. Tests can be ordered by disease and/or ICD-10 codes, or by test or CPT codes. Diseases can be searched randomly, either by disease name or ICD-10, or by organ systems and by the organ or tissue associated with the disease. When ordering tests by disease or ICD-10, each disease will list tests associated with the disease ranked and scored from 1 to 10, based on specificity to the disease, clinical relevance, and medical necessity, with 10 score being the most associated and clinically relevant. Each disease has its own ICD-10. Every submitted order will have the right ICD-10 to meet medical necessity. Many patients might suffer from more than one disease or condition. In this case, our software can add more diseases to the primary disease order. Tests with the score of the added disease will be included with the primary disease order without doubling or overlapping scored tests. In addition, the system will add ICD-10 codes to the primary disease so that any time the order is sent to the lab, it will send all ICD-10 codes to meet medical necessity. The test database can be searched randomly by test name or synonyms. It can also be searched alphabetically by test category and by specimen type. When searching by test, the system will list diseases associated with the test. Each disease will have a score ranking from 1 to 10 based on specificity to the disease, clinical relevance, and medical necessity. More information can be found by clicking on the test. Each test will have its own content, test overview description, clinical utility, test interpretation, reference ranges, methodology, specimen collection, additional testing, TAT or CPT codes, specific ICD-10 code, associated disease list, symptoms and LOINC code, and resources or references with which the content was based off of. For example, you can check the references we use to identify that test and drill down if you want to see the publication. Our system follows Medicare and Medi-Cal guidelines to minimize ordering of unnecessary tests. We use the following test indications: screening and initial testing, diagnostic testing, and disease management testing. This testing indication will give physicians a good start with the most likely disease-related testing to get more findings to nonspecific presented symptoms. Therefore, selected tests are usually simple, quick, and not expensive, and will provide a good lead to further diagnostic testing. The management testing indication, also known as follow-up testing, applies to tests employed to monitor the treatment and management of disease. These are tests necessary to monitor disease progression, effective therapy, disease or therapy-related side effects, and/or development of complications, disease prognosis, and prediction. In general, diagnostic testing can be viewed as the logical continuation of the screening indication, with the goal of identifying the suspected disease. Selected tests are usually diagnostic, esoteric, sophisticated, and expensive, often diagnostically confirmatory. Our customers tell us the advantages they have experienced with LDS, which is offered by Medical Database. LDS Analytics, which is also part of our platform, is an enterprise analytics dashboard that profiles and benchmarks lab orders and remittances by provider, practice, and lab.